Giving back to the community is critically important to Regal Medical Group. In July, Regal sponsored a community healthcare dialogue luncheon event to offer neighbors an informal discussion on where we go from here after healthcare reform legislation passed. The event was co-sponsored by the North Valley Chamber of Commerce and the Santa Clarita Valley Chamber of Commerce. Over 150 guests listened to the influential panelists, including Dr. Adam Solomon, Assistant Medical Director, Regal Medical Group, Mr. Fred Bauermeister, Executive Director of the Free Clinic of Simi Valley, and Carrie Carmody, the COO and Interim CEO of the California Region for Providence Health and Services. The Honorable Assemblyman Cameron Smythe, 38th District, who is a member of the California State Assembly Committee on Health, moderated the panel.
The ideas in this bill is to bring up these organizational structures that will bundle payments and work together. What is the physician's interest? What could the physician be doing? What is the hospital doing? What could they do better? And once the patient's out of the hospital and in a skilled nursing facility or some other, or maybe at home with home health, all of that spectrum of care, again, what organization is going to look at that and try to manage it as best they can to improve the quality and reduce the costs? And again, Regal is one of the companies that's doing that, one of the reasons I came here.
How do you think the healthcare reform will impact our hospitals?
Are there enough acute hospital beds? Because what's happening is we're all aging, the baby boomers are all aging. We know there's a capacity issue. And how are we going to fund that? It costs $1.5 million per bed. To build a hospital. So if you're building 200 beds, you can do the math. That's $300 million. Every piece of equipment you buy for a hospital is $1 million. Doesn't matter what it is. It's $1 million plus construction, which adds another $1 million to it. So as we go forward, how are we going to be able to fund and sustain our individual hospitals to meet not the need only today, but 10 years from now when we're all 10 years older and need some acute care?
As this unfolds between now and 2014, we're going to figure out how it affects us. There's going to be greater utilization in the future of community clinics by folks that have less access, the folks that fall between the cracks. Also, I think there's going to be emerging new technologies and new systems for delivering health care. And we're talking about technologies where you will be able to take a picture of a rash on your arm with your cell phone and email it to your doctor. The doctor can look at the rash and maybe prescribe, so there's no need to go to see a doctor in his office. So these kinds of things are going to come out, I think, in droves now.
The HPN family of medical groups, including Regal, is the only medical group in California sponsoring these vital community healthcare dialogues, letting the public know we are here to answer the tough questions the new federal and state legislation has implemented.